A newborn comes to our life with a lot of joy and happiness, but along with that, they bring us a lot of mysteries as well. We don't know what is normal, what is abnormal in babies, when to get concerned, when to be happy. So in this video, I'm trying to untangle some certain issues that are there in our minds. First and foremost, the universal complaint is inverse sleep cycle. That is, the baby sleeps during daytime and at night they keep on crying. They keep on crying at night when you try to put them to sleep. If you try to feed the baby, you take the baby around, you try to sing to them, talk to them, they usually keep quiet. So the inverse sleep cycle in babies is basically because the maternal hormones for lactation, prolactin and oxytocin, is secreted more at night. So for the same effort they put, they get more milk at night. So they tend to be active at night and tend to feed more during night. They give us time during daytime, so be prepared for that. And trying to deprive them of their sleep during daytime and then trying to put them to sleep at night also won't work. You'll lose your sleep during day and night as well. It will go on for weeks, and if you're lucky enough, it may go on for months. So a mandatory shift doesn't occur at one particular time. It takes its own time and it varies from babies to babies. Especially in twins, one baby may change and the other may not. So the caretakers have to be prepared for to handle that situation. The next confusion is, what is the normal temperature in babies? 36.5 to 37.5 degrees centigrade or 97.5 to 99.5 degree Fahrenheit is the normal temperature of the baby. The head of the baby feels warmer, especially if the baby has got a shaven head or there is less hair. You feel the head to be slightly warmer. That is basically because the skin there is more thicker, and because of hair follicles, the heat loss is lesser from the head surface. And so the feeling of warmth over the baby's head is a normal phenomenon. A normal baby at normal temperature will have warm body all over. If you touch the tummy of the baby and the sole of the baby, it will be same. If the baby is in cold stress, that is, if the baby's temperature is between 36 to 36.5, the baby's tummy will be warm, but the sole will be cold. So that is a sign of cold stress, and the baby have to spend a lot of energy to maintain the temperature there, and it may affect the weight gain as well. The next thing is acrocynosis. When the baby is very cold, what happens is the peripheries, the palms and soles appear slightly bluish. That also is a sign of hypothermia of babies. And of the bluish discoloration of palms and soles is not necessarily a problem of the heart. So you don't have to get too much worried. Try to rewarm, see if it is disappearing. If it's disappearing, then you don't have to worry. It's probably because the temperature maintenance is not proper. Cutis marmorata is something like a spider web on the baby's body, reddish designs like marble. So that is also a sign of hypothermia. So if you rewarm the baby, this sole will become warmer, the bluish discoloration disappears, the cutis marmorata disappears, then there is nothing to worry. It's probably a sign that you should be more taking care of the temperature maintenance with more effort. Now coming from head to toe. The baby's head is much bigger when compared to the birth canal. So when the baby reaches out, there will be overriding of the skull bones. It's called molding. So that sutures appearing very prominent, and you see upriding or a shelving between the bones of the skull, which is normal. There's something called as caput succedaneum. When the baby is lying upside down for a long time, there is a little bit of edema on the most dependent part. It's called caput succedaneum. It disappears in say 2 to 3 days, and if you try to apply a little bit pressure over that area, there will be a little bit of pitting. Caput succedaneum is a normal thing. It disappears by itself. It's a self-limiting. It's totally harmless. A swelling which is quite similar to the caput succedaneum is Cephal Hematoma. That is a collection of blood in between the layers of the skin. Cephal Hematoma is slightly of more concern because it is basically hemoglobin which is collected there, and that may become bilirubin later. So there's a chance of a slightly higher rise in bilirubin. And caput succedaneum usually disappears by 2nd to 3rd day, and Cephal Hematoma becomes very soft by that time. So that is the differentiating feature. And in babies extracted through vacuum delivery will have a slightly bigger swelling that is called chignon. All these disappear by its own, except that we have to keep a watch on bilirubin in babies with Cephal Hematoma. Hair fall in babies, all the thin hairs in babies usually fall up. They are called lanugo. It is it's a normal phenomenon. There is nothing to get concerned about it. Anterior fondal, all these bones have got joints in between. They are called sutures. And when two sutures join, it becomes a junction. So in front, there's a huge junction. It's called anterior fondal. that disappears by 1.5 years, which is a normal phenomenon. And sometimes you see a pulsation of anterior fontanel. You don't have to get worried about it. The similar one, which is not very familiar with people, is posterior fontanel, which usually disappears by 1.5 months. It's much smaller and it closes faster. It's the suture. It's a junction between the suture on the backside of the head and the center of the head. Then you have got something called as positional plagiocephaly, a flattening of head on one part of your head. That is because it's seen slightly during the later age. That is because the baby is applying constant pressure on the same area when the baby is lying down. It's impossible for a baby to hold their head straight, however hard you try. So they tend to turn towards one side, and if they keep on turning towards the same side, that side the head becomes very flat, and there may be a compensatory bulge on the other side, and there may be hair loss on the same side. So the ways to prevent it is to change the position of the baby's head quite frequently, trying to hold the baby for some time during daytime, at some point of time. All these things decrease the constant pressure on that area, and it helps the baby. And also tummy time. When the baby is awake and you're supervising the baby may be put on the tummy for say 3 to 5 minutes every day for 2 to 3 times a day. All these things are normal in the head and neck region. Two things which are abnormal are, one is craniosynostosis, where all the sutures and all the fontanels are closed by the time the baby is born or very soon. In that case, what happens is the brain volume gets compromised, and there may be a problem in brain development. And the baby's turning towards one side while lying down is normal, but if the baby can't turn the head towards the other side, that's probably because there is stiffening of the muscle on either side of the neck, one of the sides. That is called torticollis. In that case, the baby may require physiotherapy and sometimes surgery. So now coming to the eyes. Periorbital puffiness, slightly swollen eyelids are normal during initial 2-3 days, and it usually disappears by its own. You don't have to do anything. Tearing of eyes is normal. Slight squinting of eyes is normal until 4 to 6 months of age. That's probably because we tend to assess the eye position from the middle of the nose, and until it's fully developed, you may feel that eyes are slightly squinted. Conjunctivitis is abnormal. That there is discharge, purulent discharge from the eyes is abnormal. You may require eye drops. And if you see that, it also implies that there is slight tendency of tears getting stagnant in the eyes. There is lacrimal glands on the outer side of the eyes. The tears get secreted from there, and then it gets drained through the lacrimal duct on the side of the nose. So when the lacrimal duct is blocked, the tears get stagnant in the eyes, and it may become infective. So the simple massage may take care of it for in most of the babies. Take 2 little fingers, apply pressure on the medial side of the nose from the tip of the eyes downwards. Do this 5 to 10 times, 2 to 3 times a day until the baby is 6 months. So minor blocks get corrected by then. If it doesn't get corrected still, then you may have to do a probing with the help of an ophthalmologist. The other thing is ears. Ear wax is normal. It's a protective coating inside the ear, and you don't have to clean it completely. Whatever comes out, you may wipe it off, but don't try to poke anything inside the ear and injure the ear. Foul smelling discharge from the ear, usually very commonly seen in bottle-fed babies, is an abnormality. You may have to use antibiotics orally or locally. Then coming to the skin, that is the largest organ of the body and of a newborn's body, and that is a place where you find a lot of signs, something normal, some are abnormal. Jaundice in babies is normal up to a certain extent. Eyes appearing yellow is only bilirubin of 5, up to the nipple level is around 10, up to the umbilicus is, up to the nipple line it's 7, up to the umbilicus it's 10, thighs it's around 15, below that it's higher. So anything up to the umbilicus, you don't have to get worried. It usually disappears by 2nd or 3rd week. But if it goes beyond that, then you need a medical opinion. You may have to require phototherapy, may need to go under phototherapy or something like that. Neonatal acne, because of the blockage of ducts over the baby's face, you may see a little bit of acne over the baby's face, but that usually disappears by itself once the baby's face is slightly bigger and the duct opens up. A similar ones at the tip of the nose is called milia. It is again normal, it disappears by itself. In breastfed infants, you may see a white patch inside the baby's mouth, especially a coating on the tongue. It's called milk patch. It's not abnormal, you don't have to treat the baby for that. Epstein pearls, when the baby opens the mouth widely, later date, you may suddenly see whitish spots on the palate of the baby. It's called Epstein pearls. You don't have to give any treatment for that. The next is Erythema Toxin, which is very commonly seen in the first 2-3 days, and it looks exactly like a mosquito bite as it happens for us. It's migratory. It may keep on migrating from one place to another during the day. It may stay for a few days and disappears completely. You don't have to do anything for that. It is believed to be something like an allergic reaction to the environment around. But actual mosquito bites looks like a dilated blood vessel. If you press it, it disappears, and the moment you release your hand, it gets filled up again. Other blood vessel dilatation on the body are salmon patches and strawberry angioma, usually which disappears by 1 year of age. That appears and stays because of maternal hormones passing on to the baby through the placenta. And once the hormone supply gets cut at the time of birth, this blood vessel starts shrinking, and by 1 year they usually disappear. Except for port wine stain, most of the blood vessel dilatations on the body disappears completely. Mongolian spots are bluish discoloration seen on the buttocks, on hands of the babies. They are because of the trapping of melanin in the deeper layers of the skin. It again disappears by itself, and it's a benign condition, doesn't require any treatment. Peeling of skin, dry skin, especially in the joints, is normal. Breast nodule in babies, in boys and girls, are seen because of this maternal hormones, estrogen, progesterone. Those hormones are required for the mother for development of uterus and breast. It's the same thing when it reaches the baby through the placenta. It may cause breast development and uterine development. So this breast nodules disappears by itself once the hormone supply is cut. Don't try to squeeze it and bring it to normal. It may cause infection and cause problems. A BCG scar, by 4th to 5th, 6th week after the vaccination, it may appear slightly swollen. There may be a little bit of pus. It gets drained out. It's painless completely, and it may happen repeatedly 2-3 times, and then you get the scar formation. So BCG scar is absolutely normal. It's a painless thing. You don't have to get worried about it. Now coming to the abnormal signs in the skin, as I told you, the jaundice levels, bilirubin levels, yellowish discoloration appearing below the knee or on the palms and soles is abnormal. You have to take a medical opinion. Bluish discoloration of palms and soles, as I told earlier, it's mostly because of hypothermia. If it doesn't disappear completely, if there is bluish discoloration of lips, tongue, or the tip of the nose, it's abnormal. You have to take a medical opinion immediately. Pallor, the palms and soles of the babies appear whitish. It's abnormal. You have to get a medical opinion. Cradle cap, because of dry skin, something like a dandruff in adults, there may be scaling of skin on the scalp. It peels off along with the hair over there. It's very common. There are shampoos available for that, and it usually settles in a few months. So there is nothing to get too much worried about, but it may require treatment. And the same dryness which appears in the body is called seborrheic eczema or dryness of skin. They are usually managed with moisturizers. And if this is combined with a little bit of allergic symptoms, it usually is what is called as atopic dermatitis, may require more aggressive treatment. Sometimes what happens is there is reddish discoloration and peeling of skin in the joints, and it looks really ugly, and then sometimes there may be watering and moisture staying there. It may be fungal infection and may require antifungal treatment. Pustules on the body. The Erythema toxicum may have a little bit of yellowish spots in the center, but big pus containing lesions on the body. Pustules are abnormal. Diaper rash, redness over the area where the diapers are applied, is mostly because of the constant contact of urine or motion over that area. That one treatment is basically removing the diapers completely, and the second thing is applying zinc containing creams over there. It is very common, but it's not a normal thing, may require treatment. Heat rashes are common. Moisturizers will help up to a certain extent. Contact rash, the place where you apply bangle or whatever it is, the area chain, the area which comes in contact with these things constantly may develop some lesions. So again, removing the triggering factor is one of the mainstay of treatment. Pityriasis alba, that is something which people misunderstand as multivitamin deficiency. It is basically dryness of skin, and moisturizers will help. Whitish patches over different parts of the skin with slight scaling. It's a self-limiting thing, and moisturizers will help to bring it under control quite fast. The milk patch, the whitish coating over the tongue in exclusively breastfed babies are common. But if it is very thick and appearing all over the oral mucosa, on the lips, on the cheeks, especially in bottle-fed babies, it is probably because of fungal infections called oral thrush and may require antifungal treatment. Wine is not the treatment. It has got specific medicines for that particular thing. Now coming to nervous system. Babies tend to have a little bit excitatory nervous system. So jitteriness. shivering of hands and legs is quite common. You don't have to worry. Startled reflex, a little small sound, a very light sound creates a huge response in the baby. It's called startled reflex. It's normal. Sleep myoclonus, in deep sleep, sometimes there's a sudden jerky movement in the baby, which is normal. If that same thing occur in a constant basis, repeatedly, with a fast component and a slow component, that's probably a seizure. That requires immediate medical attention. And seizure may not be quite evident as in adults. Sometimes what happens is there may be just a lip smacking or twitching of eyelids. So all these things can be seizures. So if you see anything abnormal like that, or try to capture it in a mobile so that you can, it's easier for the doctor as well to get what actually happened. If the baby is too lethargic, too sleepy, lazy even to feed, that is abnormal. If the baby is very irritable, keeps on crying whatever you do, inconsolable cry, that is abnormal. If the baby is very floppy, you try to lift the baby droops through your hands completely, falls down, it is abnormal. In the same way, if the baby is very stiff, you try to hold the baby on the axilla and both the hands stay like we play like an aeroplane. If it stays straight like that, it's abnormal. You try to put in a nappy and the baby's legs are very stiff and it's crossed, it's abnormal. So stiffness and floppiness both are abnormal. You may need to get a medical opinion. In respiratory system, the normal breathing rate of adults is less than 20 and babies breathe from 40 to 60 times per minute. So that breathing pattern, the difference in the breathing rate is quite evident in babies and it's nothing to get worried about. In deep sleep, what happens is the babies breathe at that particular rate and then suddenly the baby may hold their breath for a few seconds and then start compensating for it after a pause. And then they breathe normally for some time and then again pause in between. This is called periodic breathing, which is normal in babies. And the baby's nasal canal is very small. The gap is very small and they are obligate nasal breathers. They don't know to open their mouth by default when there is a nose block. So they always try to clear their nose. That's why they sneeze repeatedly initially, which is absolutely normal thing. Sneezing in babies is normal. It's not a sign of infection. And sometimes what happens is to clear the throat, the babies may cough. Once or twice, they may cough continuously and then they stop. If the cough goes on for a long time, multiple times, 5-6 times, then it's abnormal. 1 or 2 cough in between is normal. Noisy breathing, as I told earlier, because of small nasal canal, normal secretions, usual secretions, especially a little bit more at night and early morning, may cause a lot of gurgling sound, which is normal. And as long as the baby is feeding properly, whatever sounds appear, you don't have to get worried about it. There is something called as laryngomalacia, weakness of the cartilage over the throat here. In that case, when the baby is supine, when the baby is lying down with back, you suddenly hear a loud sound. It's a stridor sound. But the baby is quite comfortable even with a stridor. It's probably because of laryngomalacia. Otherwise, a stridor sound is of concern and you need to rush to a medical facility. If the baby is actually in distress, breathing difficulty, usually what happens is the baby breathes very fast and you see all the muscles in between all the ribs going inside and the baby will breathe with loud sounds like grunting. They breathe against a closed glottis when they breathe out and that causes that grunting sound. That is a sign of distress. And if the babies have a difficulty in feeding, then you have to probably be concerned about it. Cardiovascular system, the heart rate going more than 160 to 180. You can see the heart beating outside and the baby is in not very comfortable palpitations. It's abnormal. The baby has got shortness of breath. The baby is sweating a lot in between feeding. Then you need to take a medical opinion. Now, the most confusing area is the digestive system of the baby. Most of the babies, or rather all the babies, have the straining tendency. That is basically to help the peristaltic movements, and that happens to each and every baby in the world. So, and that happens spontaneously even at sleep and things like that. And you don't have to get too concerned and you don't have to lose their sleep of that. And treating that is a futile attempt. Just leave it alone. Treating a disease is okay. Treating a normal phenomenon won't give you any result. The same with gas. As long as the baby is on milk-based feeds, the baby will have gas. And when the baby swallows milk, if the baby swallows a lot of air with that, the baby keeps on burping in between, which is normal. And when the gas is passed as flatulence, that also causes a lot of foul smell, which especially during milk-based feeds, and it's worse when babies on animal milk or formula milk. So that is a normal thing. So what something which you can prevent is to decrease the colic and things like that is, one, go for exclusive breastfeeding. After feeds, put the baby on your shoulder, pat properly. Sometimes you may hear a loud burp, or sometimes multiple small burps, or sometimes you may not hear a sound at all, but still putting the baby on your shoulder and patting is very important. Continue that for 5 to 10 minutes, or you can put the baby on your thigh and do the same thing. You can give a little bit of tummy time to the babies. Putting the baby supine and giving a little bit of cyclic motion of the legs also helps up to a certain extent. Maternal diet hugely influences the colic pattern of babies. Certain Ayurvedic medications, certain food like prawns, crab, jackfruit, all these things are usual culprits which cause a problem. If you find such a problem, then you have to avoid them. Otherwise, I'm not in a position to comment on whether you can take it or not. Then something which is usually concerning is slight bleeding from the umbilical part once it falls off. That may happen for 2 to 3 days, but cleaning that area properly, mopping that area dry, and keeping it clean is the treatment for that, and it heals without much issue. Sometimes babies may have a tooth at the time of birth itself. It's called natal tooth. If it is very loose, you may have to remove it. Crying before and after passing urine is normal. They don't know to strain to let their urine or stools out. So they may yell when they get that feeling. And once it is out, because of the soiled cloth and wet cloth, they again cry. So crying before and after urine and stool is normal, but while passing urine, if they cry, it's abnormal. Loose stools, the motion goes through a lot of changes during the course. Initially, it is black stools, it's called meconium, and then they start having loose stools, which happens for 2 to 3 weeks, and then they start passing paste-like stools, and that goes on for some more time. So once it is semi-solid, baby may not pass a stool every day. There may be a gap of 3 to 4 days, sometimes up to a week. As long as the baby is feeding properly, no vomiting, no abdominal distension, you don't have to treat it. Just leave the baby alone. Yellow stools is normal. Green stool are as normal as yellow stools. You don't have to treat it. Sometimes once the baby is started on complementary feeds, you may see undigested food of what you have given, beetroot, carrot, different multicolored stools being passed. All these things are normal. Yellow urine is normal, especially when the baby is on multivitamin drops. Pinkish crystals seen in the nappy, especially in boys, it's called urate crystals, is normal, most commonly seen in summer season. Pseudo menstruation seen in girl babies. As I told earlier, the maternal hormones which passes through the placenta and reaches the baby may cause slight development of breast and uterus. And once the hormone supply is cut when the baby is out, it may cause menstruation as in adults. And that happens, the bleeding may happen for 1 to 2 days, which is normal. Whitish discharge also may occur in female babies due to the same reason. You don't have to treat it. Abnormal things in gastrointestinal system. One is tongue tie. The baby's movement of the tongue is restricted. Some babies have it very severe that it affects their feeding. In that case, you may have to get it corrected immediately, but otherwise after 6 months before they start talking, you may have to get it corrected. Dental caries is abnormal. You have to take a dental opinion. Persistent vomiting and bilious vomiting, yellowish discoloration in vomiting is abnormal. Abdominal distension along with constipation and vomiting is abnormal. So you have to get it checked. Colic, as I told earlier, you may be able to correct it up to a certain extent. If not, you may have to take a medical opinion. Umbilical granuloma, umbilical falling off, a little bit of blood stain is normal, but if there is continuous foul smelling discharge from there, it's probably because of a granuloma and it requires treatment. The umbilicus protruding out, it's called umbilical hernia. It's not because of water entering the umbilicus, it's a hernia and it disappears by 9 months to 1 year of age. You don't have to treat it, it's a self-limiting thing. But inguinal hernia, a hernia in the lower groin region, is abnormal. A swelling which appears when the baby cry. When you try to press it inside, it goes inside. It's probably a inguinal hernia. As long as it is not obstructed, it doesn't cause much of a problem, but it is mandatory that it is shown to a surgeon and may need to be corrected. White stools is abnormal. Green, yellow stools are normal. White stools are probably because of a problem in the bile system of the baby and the bile is not reaching the stools. In that case, it requires a surgical opinion, and it's kind of an emergency and you need to get treated. Crying while passing urine is abnormal. Before and after is normal. Poor urine stream, especially in boy babies. Usually in boy babies, you get a stream which is quite long enough to wet the caretaker. If the urine is continuously dribbling onto the baby's leg, then it's abnormal. You have to get it checked. There is something called as posterior urethral valve, and that has to be ruled out. If the baby is not passing at least 6 to 8 times urine per day after the first week of life, then it probably means that the baby is not getting adequate milk. You have to get it confirmed. In musculoskeletal system, the usual concerns are genu varum. There is a bowing of legs below that. It's called physiological genu varum, which is normal. And flat foot, pes planus, it's again normal. But the foot of the baby bent completely downwards, it's called CTEV, congenital talipes equinovarus. It's abnormal and may have to get treated right from the beginning. Physiotherapy, cast, and in worst cases, surgery. Then you got developmental dysplasia of hip, where the ball of the hip joint is not inside the socket. So whenever you take care of the baby, even in routine babies, the hands are tied tightly, the swaddled tightly, and the legs are usually flexed a little bit and held a little bit loosely, so that if at all there is a dislocation of hip or there is a tendency for a dislocation, it is falling back into place. So these are the phenomena which is normal and which are abnormal in babies. Hope this helps you to elevate your anxiety and try to enjoy your parenthood. Thank you.